Let's look at our arm anatomy. We're going to start with bony landmarks first and then move on to the muscles themselves. So let's just kick off. The first bony landmark that we need to know is called the acromion, and it happens out on the shoulder. Grab this pen. It's this region here and there. If you feel on yourself, if your shoulders are anything like mine, not super muscly, you can feel this blade of bone almost up on the top of your shoulders. That's the joint between the scapula, which we'll talk about, and the clavicle, which we talked about a little bit. Knowing this landmark is super helpful because it helps you know what the shoulders are doing for one. Like in this instance, one shoulder, if I know this landmark and this landmark, I can see that my shoulders are on a tilt. Right? That's really helpful to be able to assess and understand. And then it's also helpful because there are muscles that route around that area. So you can use those acromions to decide what the shoulder muscles are doing, what the trapezius we looked at last time is doing. So that was this number 8, acromion. That landmark happens at the top of the shoulders. It's that flat bony spot. And no matter how much muscle you get, that bony spot will still be close to the surface of the skin because there are no muscles that cross that area. It's similar to ACIS down below, that kind of divides between, use my pen. If we remember, ACIS kind of divides between the muscles that are above in the torso and the muscles down in the legs, which we will get to. This is another dividing spot along the clavicle, which we're not going to need to know, but you can just call it the collarbone, what we know is the collarbone. That bow shape there, and then even onto the back, we'll look at in a second. There are no muscles that cross over that boundary really. They stay below it. There are muscles down below, and there are muscles that go up above, notably the trapezius, the sternocleidomastoideus. But this is kind of a natural boundary between the muscles of the neck and back a little bit and the muscles that are down lower in the torso. So it's good to know that there's bone close to the surface all along there. Let's look at this from a slightly different angle. So if we maybe come from the back here, that dividing line, it's all along here out to the acromion and down this ridge on what's number 9. The bone is called the scapula. We'll look at that in a second. This ridge is called the spine of the scapula. That's a dividing bony area that stays close to the surface of the skin. So you can use that when you're trying to figure out what you're looking at. Finding these places where the bone is close to the surface of the skin can really help you orient what the muscles are doing, which the muscles can be kind of confusing because they take on so many different shapes or so many different sizes, really. The bones tend to be human to human, relatively similar. The muscles, not so much. Okay, so that's our dividing line with the acromion. Number 9, the next thing to look at is this bone, this triangle bone in the back. Really helpful bone to know. This is called the scapula. You can see up here in the left. The scapula is essentially a triangle. If you just think of a right triangle, that gets you pretty close. When the arms are at rest, these triangles kind of match along their inner edge with the spine. So spine's going straight, those triangles are kind of straight on the inner edge. If this arm were to be raised up, so let's say that's my stand-in for the bone of the arm being raised up, what you'll find is that this bone will pivot like that. So it's really a nice thing to be able to see when you're looking at a back. You'll often see a kind of a bulge out there as well, where that bone's kind of maybe pushing the skin and muscle out when the arm is raised up. So that's worth remembering. And there are muscles that interact with this bone. There are muscles that start here, that infraspinatus and teres major start underneath the spine of the scapula. So they start on the under part of the scapula. And then the trapezius starts out at the acromion and around onto the clavicle a little bit, up to the base of the skull, down the spine to the middle back, and then it kind of takes a trip up to that spine as well. So this clavicle really helps you orient what's happening in the muscles of the lower back. And then latissimus dorsi lops right around there, up into the armpit and down. And one of the key things is being able to find this part of the scapula, but also understanding that it's this triangle shape. Okay, that's it for the shoulder area. Just a couple of things. Acromion and scapula will get us there. Obviously, it's better to know more landmarks, but that's going to be our basis to start from. Let's look at the elbow. There's some interesting stuff happening at the elbow. And so we're going to look at them independently. The first one is going to be this number 10, and it's called the medial epicondyle, and it belongs to this bone here, the humerus, this upper bone of the arm. This bony bump that sticks out right here is called the medial epicondyle. And medial just means it's close to the midline of the body. So the center of the body, this medial epicondyle is closer to that center line of the body. And it's this big bony jut out. We do have a lateral epicondyle. It's this one out here, but we don't need to know it necessarily because we don't see it quite as clearly as this one. The medial epicondyle is going to be important when we get to the muscles. Whenever you see a bony bump, like a big bump on a bone, you know it's there for a reason. Most likely there's a bunch of muscles that attach to it, and it's quite important in anchoring a lot of muscle. All right, next in line is this bump right there. And this belongs to the bone of the lower arm called the ulna, and it is called the olecranon. This is the sharp part of your elbow. If you bend your elbow completely, like maybe grab the back of your neck and you see down at your elbow that sharp, bony bump, it's kind of what we think of when we think of an elbow, that sharp bone. That's this bone. And it kind of disappears a little bit when you straighten your arm. It really shows up when you bend your arm as kind of just a bony protrusion. The only other bony landmark for us to look at for now is right here at the wrist, and mine shows up as this ball of bone down at my wrist. So it's sort of on the pinky side of your wrist. There's this rather prominent bump. Some people it's very prominent, some people slightly less so, but it is there. And it's just the other part of this bone. So we have the olecranon here. This is called the head of the ulna. That ulna is the name of this bone that runs all the way down. And that's a great divider. There are muscles on either side of this ulna, but none that really cross over it significantly. Sometimes they get bulgy and kind of, it gets buried down in between the two bodies of muscle, but they don't kind of cross over and hide the bone entirely. Let us look at the muscles, and we're going to start with easy. Let's turn on all these muscles. We're going to start with number 1, called deltoideus or deltoids, the delts. That is this muscle. I'm going to hide this. This muscle is really weird. It's called the platysma, and it's just like, it gives you those streaks in your neck when you really tense up your neck, but it also gets in the way when we try to look at anatomy, so I'm going to hide that. All right, let's look at this one. This is called the deltoideus or deltoid, and this is just what we know as our shoulder muscle. I like to think of this as the Lego hand muscle. It looks almost like, I don't know if you ever played Legos, but it almost looks like the hand of a Lego character. It helps me remember how it attaches. We'll notice that it attaches, I'm gonna grab my pen here. It attaches on the clavicle here before we get to Pectoralis Major. Please note this gap. This gap is really helpful. It shows up as a shadow shape in the front of the arm quite often. It's a really good tell on separating the Pectoralis Major from the deltoideus. So it connects along the clavicle there, on the acromion, and down the back of the scapula. So it wraps all the way from front to back. Almost if you imagine your hand was grabbing this person's shoulders, your thumb might be in this divot here, and then your fingers would wrap around the back. So that's where it originates, along those bones, and then it attaches down here on that humerus, that single bone of the upper arm. In anatomical terms, this is called the origin and insertion. Probably the most important things to remember about the muscles is their shape and their origin and insertion, whether you know the name or not. This is what that looks like all by itself. You can see it attaching all along those bones and then sweeping out and attaching right onto that arm bone. And you can imagine if this muscle were to contract all of its fibers, that this bone would start swinging upwards, and that's what this muscle does. It raises your arm. Okay, moving on. We have this muscle. Let's look at it by itself. This muscle is called the triceps, one we might also be familiar with. One important aspect of the triceps that you do see, though, is this kind of horseshoe shape in the back. So everything that's white here tends to be a flat strap of tendon. You see this kind of tube of muscle here. That overlap happens quite often. And this side that goes down. All to that olecranon, by the way. So this muscle attaches to the olecranon, and when it gets shorter, your arm straightens. So really strong muscle, important muscle. Here's what it looks like from the side. And this, often we see it kind of like this. There will be this bulge that comes around down to the elbow, to the olecranon. And then we'll see this cut-in shape there, like that. I think a lot of times when we think of an arm, we think of the next muscle, which is biceps. So that's number 3. It's important to note, though, that the triceps is just as important as the biceps, and oftentimes much bigger. In this model, the biceps are quite large. A lot of times in just an average person's arm, this triceps is going to be a larger muscle grouping than even the biceps. Let's look at biceps really quick. This is where this muscle attaches. So up on the scapula, goes down the arm and attaches to this bone of the lower arm. This helps you bend your arm. So when this muscle flexes, your arm bends upwards. Number 4 is a muscle that we can easily miss. And oftentimes it kind of blends in with the biceps, but it's number 4 here, called brachialis. It doesn't really blend in with the biceps. So often we can see it separately in the arm. Here's where it goes. It goes from it originates in this single bone of the upper arm, the humerus, and it inserts down here on the ulna. And when it flexes, it also helps the arm to bend. You can see this separation is very clear in a muscly model. Number 5 is a really nice muscle for the lower part of the arm. It's kind of my divider muscle. I consider it to be a divider muscle, and it is called Brachioradialis, number 5. The thing to know about it is that it starts up here on the bone of the upper arm, kind of midway up, and then it heads down towards the thumb. And it's going to be our divider between the 2 muscle groups we're going to talk about in 6 and 7, sort of the last muscles to talk about. And there are a ton of small muscles here. We're just going to talk about the groupings. So on one side of the brachioradialis, we have number 6, which is the extensors. The extensors are these muscles that go from just to the side of the olecranon, and they flow down the back of the arm towards the back of the hand. They're called extensors because they extend the fingers. You can think if you stretch your fingers as straight out as you can get them, these muscles are responsible for that. They extend the fingers. And so they're the extensors. Note how they go. So if the person's standing in this pose, which we're behind the person now looking at the back of their hand, they start on this side and they flow down the back to the wrist. So that's the flow of these muscles. They go down the back of the hand towards the wrist, and they end in these tendons that attach to the fingers. So if I look at the muscles that are on this side of the ulna, and incidentally, they're on that side of the brachioradialis. So the ulna and the brachioradialis are my dividers. These muscles do the opposite of the one we just looked at. They start here on the inside, on this medial epicondyle. There's a lot of them. See how they all attach to that bone. And they flow into the inside of the wrist, and they are responsible for closing the fingers, which is called flexion. When you flex a joint, you're kind of closing the joint. So they are called flexors, number 7. There are individual muscles in here, and it's really kind of nice to know them, but for our purposes, we are just going to treat these as one big grouping called flexors. One thing to note is that you can see the tendons a lot better down here at the wrist. Mainly the big part of the muscle is up here, and then it gets thinner and turns into tendons down here at the wrist. All right, that will do it for muscles of the arm. Now the trick is to be able to take these landmarks, take this information, and be able to employ it in a drawing, which is easier said than done, and that's where the practice comes in. It's knowing these things is one thing, being able to label them is one thing, seeing them is a whole nother thing, and that's the most important part of this. In your anatomy handout, you'll see there's another page that shows these muscles. So all the numbers labeled here in this page show up on this page as arms in positions to help you identify where these things might be in a normal arm. Please look these over. This is where that morpho book really comes in handy because it's got a lot of this muscle drawing in various positions, various arms. You can really get a good overview of the different ways these muscles and bones show up in the models as they pose. All right, that will do it for arm anatomy.